Okay, it's the time of the show where we have to talk about coronavirus, especially after this completely insane weekend of new cases that we've had, because the United States has quietly, slowly, during early to mid and now into late June, we have had a period where we surpassed the worst days from April in terms of new cases of coronavirus each day. We hit a single day new case record of more than 47,000 cases on Friday, followed it up with another 43,000 cases on Saturday, another 40,000 cases on Sunday. So the pandemic is worse than ever. What we believed was the peak nationally in late April has been blown out of the water by the new case numbers of late. Now, as a reminder, the right loves to say, we have so many cases because we're doing so much testing. This isn't really a concern. We're doing more tests, so we're finding more cases. Everything is fine. This is not true. And as you can see, if you're looking at the graph that we're putting up on the screen right now, the percentage of positive tests is going up. That's the blue line. One of the things you look for to see if more cases are merely because of more tests is you look at whether the percent of people that test positive goes up, down, or stays even as you do more testing. And at the national level, the positive test rate has gone from about 4% in early to mid-June to about 7% now, okay? That's a 75% increase in the positive test rate nationally. That is insane. For comparison, some of the states that are doing okay so far, Massachusetts, Connecticut, others, the positive test rate is sometimes under 1% or between 1 and 2%. When you do much more testing, you would want or expect that positive test rate to stay even or go down if you are managing the pandemic well. If as you do more testing, the positive test rate keeps going up, it's very, very bad. And that's exactly what's going on in the United States right now. Now, we're going to talk about states that are doing well and states that are doing less well. I'm in Martha's Vineyard in Massachusetts right now. Why am I here? Well, the advice is the safe thing to do as states reopen is to do in-state trips that require driving but not flying. And of course, to wear a mask and all of that stuff. Martha's Vineyard is one of the parts of Massachusetts that has been less hit by the virus. And when you walk around, you can tell why. Quite frankly, other than tourists from other states, everybody's wearing a mask. There are outdoor pedestrian areas that are outdoor mask zones. There are restaurants open for outdoor dining. You've got to have your mask on up until the moment that you sit. Everybody's doing it. Every employee has a mask. You can tell why the numbers are what they are. On the other hand, we've seen a complete unflattening of the curve thanks to some of the recent worst offenders. And those are, as of right now, Arizona, the Carolinas, North and South, Florida, Arkansas and Alabama, Mississippi and Louisiana, Utah, Texas, Nevada, Georgia, Iowa, California, and Tennessee. Shockingly, the absolutely useless, toxic Republican Governor Greg Abbott admits he would not have opened bars so quickly, knowing what he knows now. Now, this is like such a minor concession. The way, the reality of Texas is they should have stopped all reopening and delayed it by several weeks and actually taken this more seriously during the closing. Just getting any admission from him, any concession is important. He says, well, I would have reopened the bars a little more slowly. In his mind, opening the stores and the restaurants, it was all fine. He just would have maybe opened bars a little more slowly. But again, this is a vile, toxic guy. His own Lieutenant Governor Dan Patrick is the one who said, I would sacrifice myself, and many grandparents also would, for the economy and for their kids or whatever. So you and I know that what Greg Abbott is admitting here is BS. The fact that he's admitting anything, though, is a sign of just how bad things are going down in Texas. Houston area ICUs in at or near 100%. We don't really know because one hospital hit 100% ICU capacity, then just stopped reporting numbers altogether. So we don't even know the full story of how bad things are getting in Texas. Consider that a bunch of states decided they had to close months ago when they had 1/10 the cases that these states have now. Understand the insanity of that. When they had 90% fewer cases than they have now, they said, we've got to close. Now, with 10 times the cases, they're saying we have to be open. It's a recipe for absolute and total disaster. And indeed, we are all going to pay the price for it. Certainly, living in certain states puts you at a lower risk for the virus, but the entire country is being collectively punished. For example, Europe indeed will not allow Americans to come in, as they are now just days from starting to open up to travel from other countries. We're up there with Brazil and India and Russia and a bunch of other places that have not handled this well. Meanwhile, you're seeing anti-mask patriot after anti-mask patriot appearing on social media, loudly proclaiming they will not wear masks. Well, that's why things are so bad, especially in certain parts of the country. And just as a reminder, Donald Trump continues to say we have the best testing and we have the most testing. We are 26th in testing per capita in the world right now. 26th, not first, not fifth, not 10th or 15th. We are 26th right now.